Very good.
Good afternoon, everybody. Today I get the privilege to speak with Chris Wayne, who is the business director at the Logan Institute for Health and Wellness. And he is going to tell us a little bit about the company, what they're looking for, hiring opportunities. So welcome, and we thank you for your time.
Thank you for having me, Brandy. It's a pleasure to be with you and very appreciative for this platform that Marion's providing. I think this is just an exceptional opportunity for students and alum alike.
Thank you. So we'll get started, and I will just ask if you could please tell us a little bit more about the Logan Institute and the work that gets done there.
Certainly. Well, as you mentioned, so my name is Chris Wayne. I'm the business director at the Logan Institute for Health and Wellness located in Fishers, Indiana. We are a long-standing medical provider clinic, and by long-standing, we've been in place. Dr. Logan started the clinic almost right at 20 years ago. And we've been in this location, I believe, for, I want to say just about 11 years currently in our current Fishers location. So we certainly have a solid history. And essentially, we are a functional medicine provider clinic. We combine traditional internal medicine with the time-honored healing arts to provide what we consider a unique and personalized optimal care plan for patients wanting to approach their well-being in an integrative or holistic manner. These are common terms that you hear now in this space. So very similar, or not too dissimilar, to what many folks may refer to as a primary care delivery mechanism, but we're a bit unique in that he really focuses on the root cause and tries to find either a solution through diet, nutrition, health and wellness, sleep habits, hormones, whatever the challenge may be, with ideally trying to avoid the traditional prescription approach. So, but sometimes that is appropriate. So that's essentially what we do. The range of patients that we see run the gambit from those who are very healthy and want to, again, be the best version that they can be of themselves through a variety of sleep, wellness, exercise, and diet. Or we also have built a reputation, very candidly, on dealing with very complicated cases. These may be individuals who have come back from the Mayo Clinic and do not as yet have a root cause diagnosis. It could be a very rare autoimmune disease. It could be Lyme disease. It could be a heavy metal toxicity through either where they lived or some prior employment exposure. So it could be just a variety of things. We also deal with cardiometabolic disorders to deal with weight management, sleep issues, as well as hormone issues. So whether it's a man or a woman going through life's natural transitions that we all have or will go through, those are the areas where we focus and have significant expertise.
Awesome. My husband has a rare autoimmune disease, so I appreciate all of the people that work in that sphere.
Certainly. I'm sorry to hear that, but hopefully he's doing well and
he is. Yep. Mm-hmm.
Very good.
So the next question is about the positions that you're hiring for now, but then maybe other positions that you have in the office that may come available.
Absolutely. Well, just to mention a couple of additional things, on top of what I've mentioned in terms of the specialties, we also focus on regenerative medicine. These are plasma-rich protein injections that help deal with joint therapy. These are oftentimes patients trying to avoid getting surgery, or surgery may not be appropriate at that time for that patient. And that's a popular therapy. He's been doing that now for over 5 years, even though PRP, or plasma-rich protein, has become more of a recent, I would say, trendy thing almost. And we deal with orthopods and others in that space. So I did want to mention that as well. In terms of the full-time positions that we are currently recruiting for, we currently have posted both a position for a nurse, part-time or full-time, and it could be either a bachelor's prepared RN or an associate's degree RN, and we are also open to LPNs. So again, we have nursing positions open right now, one that is posted, but we have a couple of different opportunities in that space. Secondly, we have a position known as a clinical support specialist position. This does not require any prior medical background. We're looking for individuals that either have or will be close to having a bachelor's degree, and it could be anywhere in the allied health space or sphere, Brandy. It could be in biology or exercise science. We're looking for individuals that are excellent communicators, good at multitasking, and can work very closely or alongside our physician to help him stay both on time and also set expectations with patients. So we're looking for good communicators in that regard. So those are the two current positions that we have posted. But again, throughout the year, we have a variety of positions, oftentimes based on either a front desk position, a reception position. We also will have an upcoming need for potentially a part-time role helping to cover our pharmacy, just given an individual that is our manager in that space currently. And so we do have a variety of positions, usually throughout the year.
Thank you. And what do you look for in a candidate? I know you spoke a little bit about it with the clinical support specialist with communication, but what other types of skills and or employability skills that you look for when hiring?
Certainly. It's the common things are, one, an excellent communicator. And that can begin by someone simply being very genuine, very personable, making good eye contact, all of the things that many of us often hear, but we may not be self-aware of how we come across and how good or what opportunities for improvement there could be, which is, I think, again, you and I spoke before this about the importance of that. And there are so many different areas to look for. So one is I look for a good communicator, two, someone who's very genuine. But that begins in the conversation with the individual. The first thing I do is, as you well know, is I look at a number of resumes. And I would encourage a cover letter, no matter how brief, can be a difference maker. It really can separate you from many other candidates. I also look for, other than the traditional punctuation and things of that nature, in a resume, I'm looking for someone that I understand new grads may not have a lot of experience, but it could be a volunteer effort that sets you apart. It could be the fact that you may have been a waiter in a restaurant. And those are positions that if you've had them in your career, they can be humbling experiences, and it demonstrates a tremendous work ethic. So don't avoid putting the thing on your resume that you might otherwise be embarrassed about or think that it doesn't apply towards that opportunity, because it could be the very difference in demonstrating your character that I'm looking for.
That's perfect. I spent 11 years in the hospitality space while going to school, serving, bartending, front desk, every position that you could possibly think of. And yes, very humbling at times.
It can be. And, interestingly, I draw a correlation with that space with healthcare, because we deal with patients that they may be doing well, but they also may be at the most trying moment in their life in terms of dealing with their own health, and whether it's mental health or physical health, and their family, especially during these times with COVID. So you never really know the challenge that an individual is facing at any given moment. So we have to extend each other a significant amount of grace. And because we work in the healthcare space and in a healthcare clinic, that is something to keep very front and center or top of mind for us. And I think individuals who have worked in some of those other spaces, such as hospitality, in roles that can be challenging to be sure, they just often have either a bit more insight or a bit more patience, and I think it builds character. So those are just some of the things that I look for.
And then if somebody is interested, well, let me back up and ask one more question before this question. Do you hire international students or internships?
Okay. We are looking at possibly internship programs right now. I know historically we've had a couple of interns within the practice. They are usually for clinical roles such as a mid-level or nurse practitioner. So I won't say that we exclude them. It's just usually if we look to hire someone, it's usually a permanent position, and we're looking for a long-term relationship, because as you know, Randy, it can be a tremendous expense and inconvenience and a challenge to your operations when you have high turnover. So we're looking for individuals to make that we feel we can make a long-term investment in, and that's our goal, and that's what we're looking for. So I won't say that internships are off the table by any means, but I think it would have to be a unique circumstance to be sure.
Mm-hmm. And that makes sense. So if somebody is watching this interested in learning more information, what should be their next steps?
I think I have Handshake currently set up for both of the positions I've mentioned, the nursing and the clinical support specialist role, for the individuals to respond via Handshake. But I would welcome the opportunity if they wanted to get on the website, identify how they contact us. Almost any website has an info at. Those are all things that demonstrate you did your homework. You went, you looked at the website, you found other means besides Handshake to send your resume. So I would encourage you're welcome to send your information to us through whatever means possible, whether it's to my email address or to Handshake. But that would be my preference, is to respond via Handshake, and then I can organize my responses to make sure that I don't miss anyone.
Perfect. And then is there anything else that we didn't cover through those questions that you want the audience to know about the Logan Institute for Health and Wellness?
Brandy, I can't think at this time what that might be, other than I would encourage you to apply, because again, we're pretty open-minded on the clinical support specialist role. And we're always looking for individuals, either part-time or full-time, in a reception capacity. And it doesn't have to be a long-term relationship. Even if you're looking to simply get your foot in the door someplace and to build on that opportunity in your career path, then let's have that conversation. And I welcome that. And I'm here to help develop individuals and improve their career pathway as well. So some of those positions may be a bit more seasonal for us, so we might have more interim or part-time roles. It's just not as common.
Mm-hmm. Perfect. Well, I thank you for your time and the opportunity to get to sit down and talk with you, and look forward to a continued partnership.
Thank you. I do as well, and good luck to everyone. And again, thank you for the opportunity. I look forward to getting your resumes and your cover letters and talking with you soon.
Thank you.
Thank you, Brandy.